Starker here from WestfordCAT, and I am with Jeff Stevens, who is Westford's health director. And we've been trying to get together once a week to sort of talk about what's going on with COVID-19 and other things as well in the town of Westford. How are you, Jeff?
Good, Patty. How you doing today?
I'm doing good. I'm doing good. I got my second vaccination, and
Very nice.
I want to know what that means for me and for
Yeah.
others. I'm not 2 weeks out yet, so I got my second vax just a couple of days ago. So how is that going to work for others who are vaccinated?
So let's just say you got your second vaccine and you're still not till a full 14 days out. You are still not considered fully vaccinated, and you still would run the requirements of isolation and quarantine if you were to get exposed to somebody with COVID. Once you're fully vaccinated, if you are feeling fine, if you are not sick, if you're exposed to somebody with COVID, you would not need to quarantine if you are fully vaccinated. That's what that really kind of means for most people. Being vaccinated does not mean it's also a free for all, and it does not mean you can throw the mask away and you're off on your way and life is back to normal. The vaccine's major job is to protect you from going to the hospital and keeping you from getting extremely ill. There are cases where people are still getting COVID that are vaccinated, and the ones I read about and hear about are far less sick, but they are clearly they may have dodged a bigger episode by being vaccinated. So it's still extraordinarily important, and it is saving people.
Yeah, so you can get the vaccine, you can be fully vaccinated, but still contract COVID and still transfer it to someone else.
Absolutely. And that's why the masks are still really important. We need to protect everybody from ourselves and each other. That's what the mask's job is to do. A lot of people are starting to not wear masks as much, and there's a time and place where you don't need them. The governor did relax the mask mandate back on the 30th of the month, which means you can go out in public, you can go outside, you can go into a park, you can go jog, ride your bike. If you're with vaccinated people in your house, you don't need to have the mask on. You can be outside. The second you go inside to a restaurant, to an indoor facility, to an event, you do need that mask. And anytime you cannot socially distance, whether you are vaccinated or not, you still need to wear the mask.
So small gatherings in your home with people who are fully vaccinated is okay. Larger gatherings in public, even if you're vaccinated, fully vaccinated, you still need to wear that mask.
Yes,
So
very.
it looks like it might be a bit better of a summer though than we had last year. How are the numbers in Westford right now?
Well, right now our numbers are trending down. We've got, I believe, 26 active cases as of today in town. And that number week to week, it is definitely trending down, but I think we're just still slightly above the state average in percent positivity of people getting tested. We're at around a 1.98, and I think the state's at a 1.5, if I'm not mistaken. So we are close to that state average, but just slightly above it. So that means we still have work to do in town. And albeit many of the cases we have in town are families and people that live together that are still contracting COVID, and they are not that sick overall, we still have people that are getting very sick, and we still need to protect ourselves from being in that situation.
Can you clarify for our viewers percent positivity?
So the percent positivity numbers, what you see from the state and what you see that I post is every 14 days, the state is taking the amount of people that are tested and the amount of people that are testing positive. So in Westford, we had a little over 1,800 people test, and we had 36 people test positive. If When I post on Facebook, you'll see there's a chart I have on there, which I'll have up later today. I've got data that trends all the way back to November. You can see the amount of people that get tested and the amount of people that are positive. Uh, It's not the amount of people that are currently sick, just the amount of people that have tested positive in 14 days.
So, what about businesses? I mean, should people start going back to work? Everyone's been, sort of, working virtually.
Any business that's currently closed due to COVID needs to check what their sector specific guidance actually says. Some of the guidance has actually been completely rescinded in certain categories. Others, like the adult and youth sports guidance, has been changed. It still exists. Things like softball tournaments, hockey tournaments are now allowed in the state. So people are slowly being able to go back to their normal lifestyle. Places like uh, bars that are just bars can't open yet, but they are eligible to open on the 29th of the month. So there's that change heading back to normal there. If there's a business that isn't open or isn't sure what they can do, they're certainly welcome to call my office and they can discuss it with me. We can look at whatever their sector is and what guidance they need to follow and figure out when they have the opportunity to open. And if there's somebody unsure of what they're doing, I'm more than happy to help clarify what their capabilities are.
So, what's the bottom line, Jeff? What do you want people to know?
What I want people to know is we're still not completely out of the woods yet, although I am extraordinarily encouraged by the direction we're headed in overall. We're not through the tunnel quite yet. It's not quite in our rearview mirror, but we're getting close. For people that need to get vaccinated, there are lots and lots of options right now. I would recommend people continue to check the CVS sites, the Walgreens sites. There's going to be a new vaccine clinic opening up in Devens next week.
Great. I didn't know that.
There's our MRC volunteers are going to help staff that. And Westford's going to have a little bit of a hand in how that operates as well. We're still waiting for another collaborative to open up that's going to be in Acton. And the reason why they're not actually in Westford is because our location and proximity to the Lowell site, which is very close to us.
Gotcha.
So when they do their circles of where places can open, Westford's a little too close to the Lowell site, and further away is where we need to be. That's really what I want people to know. There's lots of options. If you're unsure where you can go or unsure if you want to get it, give us a call, talk to my nurses, talk to myself. We're more than happy to be able to discuss what your options are, where you can go. Many places are taking walk-in options at this point. There are lots of appointments available. I logged on to just the Lowell vaccine clinic site this morning, and I had just creating an alias to just see what the availability was. There are hundreds of appointments. So there's an ample supply of vaccine, and there's not a lot of reasons why people can't get it at this point.
It's great. And I agree with you. I did the same thing just to see what's out there. And yeah, there's just vaccination sites everywhere with availability. So it was a little bit of a slow roll, but now it just really seems to be hitting full gear. And I think Mass is doing a great job, as are you guys over there in the health department.
Oh, thank you very much.
All right, Jeff. Well, thanks a lot for the update, and we'll touch base again next week.
Can I give one shout out to a few people before we leave?
Absolutely.
So today is Nurses Day, and it is Nurses Week in the state. And I'd like to just give a shout out to our public health nurse, Gail Johnson, who's been doing an outstanding job in contact tracing, working tireless hours on a regular basis and putting the town before herself, as well as we've got several other people that have been helping out with Sue Hanley, a board member, a school nurse at Stony Brook, who has just been outstanding, and Jennifer Ross, who's been on our staff that's been helping out regularly with the contact tracing. They're amazing nurses. They're doing heroes work, and they deserve a lot of praise.
Yep. Bravo to Gail, to Sue, and to Jennifer. Thank you for mentioning them, Jeff. All right. We'll talk to you next week. For WestfordCAT, I'm Patty Stalker.